Nationalize healthcare now, insure 100% of the population, and eliminate insurance companies immediately. Eliminate the insurance companies immediately. This is a revolution. It's time for a revolution. Hundreds of thousands are dying because of the current system. We need to revolutionize the system and throw the money changers out on their ear. That's the big message here. Now I'm going to go into the details. The COVID-19 pandemic has shown that our current healthcare system based on profit is no system at all. It has been an epic fail in caring for us. Epic fail. No other way to describe it. Hundreds of thousands will die unnecessarily in April of 2020 and May of 2020 because of the current inefficient system. Sarah Palin warned us about death panels. Well, we have them. We don't have what she envisioned, but we definitely have death panels, and they're in the form of the insurance companies, the for-profit entities. They ration care, they make things inefficient, and COVID-19 is now the way that they're killing us with their death panels. It's unnecessary. It was unnecessary. It's unnecessary now. It has always been unnecessary, but this has brought it to light. To fight to keep the existing system is just wrong. It's immoral. We have to nationalize healthcare. That's been shown. It couldn't be more clear. We need to make it a right within this country. We need to ensure 100% of the people within our borders, centralize administration, have centralized quality care for our system. We need to centralize treatments, labs, and pharmaceuticals. Everything needs to be baselined for basic rights of healthcare. Is it going to involve some rationing? Not as much as you think. There needs to be some in any common sense system. You can't give everybody everything all the time. But we have the money to take care of each other. We're just choosing not to do it. And a large part of that is the insurance companies, who are basically a death panel. We needed a national disaster system in place in order to handle things after, like Hurricane Katrina. FEMA had fallen apart after 2005. We fixed it. FEMA is a model now for how to bring care to people when they need it, and it's doing a great job since then. It was a shock to us. We need a similar national disaster system in place, tested and ready to launch in the case of future pandemics. If there ever was a lesson learned from this whole thing, it's that we need to have the PPE in place. We need to have some way of moving equipment like ventilators around wherever they're needed within the country. Some certain block of them are needed, but they don't need to be everywhere all the time. They need to be in the right places at the right time as needed. We need sufficient bed space. We need trained people, and we need them armed with PPE and equipment like ventilators. And these will be surged into hotspots. That's the model that works, and that can only work in a centralized system, one where for-profit is not part of the equation at all. In no part should for-profit be part of our healthcare systems. And I will go into more detail. Oh, it costs too much. Believe me, I will address that. We can cut the costs to a third or less than what they currently are by just doing some relatively simple things. This idea that somehow or other, oh my God, centralized healthcare is going to cost us too much. How much it's costing you today? It's costing you your life and your money. But I'll talk about money in a minute. But it's costing you your life. In April of 2020, it's costing you your damn life. What's that worth? What's the cost on that? How much did that cost? Anyway, I'm sorry, I'm getting very emotional. So, the lobbying stranglehold that the insurance companies have had on our healthcare system, it's immoral. It must be undone by revolution today. They are the enemy. They need to be eliminated. I'm not going to mince words about this. They are killing you and your relatives today. And they don't mean to. They're not bad people. They're profit-making entities, and they behave like profit-making entities, which is they don't give a damn. They only want to make money. And they make money on you and your life and your health care and your family's life. They're about as useless and costly as they can possibly be within this system. Disposing of insurance companies and replacing them with a 3% centralized administration, it's not only cost effective and a huge savings, but it is humane and helpful. It would have saved hundreds of thousands of lives in 2020 had we had it in place. But everybody was bickering, oh my God, it's going to cost too much. So let's get down to costs. I've made my point about how bad they are. The number one cost in our current healthcare system as it exists is bankruptcies. Personal bankruptcies are huge. And when they happen to you, they are life-changing. You may have to continue to pay for them for the rest of your time on this earth. Once you have had some problem that cost you $50,000 or $80,000 or $100,000, all of a sudden you and your family and your heirs are saddled with this cost. How much is that costing you? Oh my God, we can't nationalize the healthcare. It costs too much. How much did bankruptcies cost you and your family? Who do you know in your life that had a bankruptcy related to healthcare? I'll bet a lot of you can answer that question and say, yeah, I've known some people who've lost everything and they're really struggling now because of bankruptcy. This is really bad. So a nationalized administration, a nationalized healthcare system, bankruptcies go to zero. So really huge social problem, very, very costly, goes to zero. That's a pretty good cost savings. Number two, insurance companies. There was a law passed back in the 90s. I don't remember exactly which congressman or senator did it, but this immoral jerk undid this. There used to be they could only make 3% profit. That was mandated by law. Some jerk undid it way back when in the 90s, when deregulating everything was just the big vogue. And it still is, by the way, and it should stop. That's a whole other discussion on another video. But now healthcare administration costs are about 33%. So they went from a mandated 3% to 33%. So 30% of what you're wasting today in your healthcare cost is going to insurance company executives for their bloated salaries and their homes in San Moritz and, you know, wherever the heck they go for their vacations with their families. These people are making money on your and my backs immorally, and currently they're killing people with the way the system is. This is where the revolution will hurt people. Well, so what? They need to be hurt. They need to not exist. It's that simple. Tort reform. We need to do something so that doctors don't have to play this defensive game. But there needs to be reasonable quality provided to people in healthcare. You need to have a way to air your grievances. It's about 15% of our costs right now due to tort reform. So again, how are we going to? We've eliminated 30% through the administration costs with the insurance companies, the for-profit insurance companies. Now we can eliminate maybe 15%, get it down to 0.5%, something like that. So that's another place. We need to deal with lawyers and with lawsuits and with malpractice. That's just out of control. So that's another big place where we can make cost savings by centralizing things and having a humane and reasonable system where you can go and say, hey, this doctor's no good, or this treatment that you're doing here is not good. You know, there needs to be a system for managing that, managing it. Right now, it's just out of control. You know, have you been injured by blah, blah, blah? Call the such and such firm now. I'm tired of those people. Okay, here's another big cost. Emergency rooms right now are the default Medicare for all plan. It's just kind of the way it is. But guess who pays for that? You and me, not the insurance companies. The insurance companies walk away from that. It gets dumped onto the taxpayers. So emergency rooms is the default for the 28 million uninsured. And guess what? They do use it. They definitely use it. Have you been to the emergency room before? Late at night? Guess who's there? These are the people who have no choice. No choice. No choice at all. And so they use that as their default system. It's costly. It's bad for them. It's bad for everybody. That's a big cost. How much does that cost? So if you could move people to being insured so where they could go see a doctor during the daytime, ER goes way, way down and actually handles real emergencies like you broke your leg or you're having a heart attack. These are things that have to be taken care of in an ER. Drug prices. We need to break that cartel. We need to get rid of the stranglehold that pharmaceutical companies have on our wallets. There needs to be a centralized, humane, reasonable system for managing what drugs are available, for whom, when, where, and how. Insulin is the big one. That's always the big one. Well, yeah, this is a life-saving serum that's helping people to have a normal life where they would have died very young and had a horrible life for up to a decade. We need things like insulin and heart medication and gastrointestinal medication and stuff. It needs to be available for people. Reasonable drug management needs to be part of the system. I don't know the cost of that, but I know it would save a ton of money. If we centralized that, managed the cost, then the drug companies could make their money. They could make their profit. They could predict their outcomes for distributing and selling product, which is fine. We can work within profit-based industries like the pharmaceutical companies if there's a predictable system into which they can plug into to sell their products. Anyway, one of the last things to talk about when it comes to cost is superusers. There's actually a not insignificant group of people who use the medical care system as a form of community, as a way of connecting with other people. It's a very sad psychological issue. It's sort of like people become hoarders, people become medical superusers. There's these things that people do to connect with community. And like I said, they are not an insignificant part of the healthcare costs. If as part of our system they are insured, if as part of our system they can see a caseworker and get community, connect with people, we can bring that cost down as well. So, I've listed a lot of very specific and prescriptive things on saving us money here, but the number one thing is bankruptcies and healthcare companies. Getting rid of them, the for-profit part of this whole entity, and insuring everybody. It eliminates bankruptcies. It eliminates a lot of the ills that the current system has. We're dying because of this. We are dying in March and in April 2020, and people will still be dying in May. They're dying because of our current healthcare system. Way more people are dying than needed to. Way more, way more. We could have gotten on top of this thing back in late December or January had we had the systems in place, but they were eliminated. They were eliminated as part of an immoral, profit-based system. Profit has its place in this world. Don't get me wrong. I'm all for profit, believe me. I am the queen of profit. Ask me about real estate sometime. Ask me about true open marketplaces like the stock exchange. Gold. I can tell you all about these things. I make money. I'm glad to make money. I'm proud of it. But when it comes to healthcare, there should be a right in this country. We need a revolution. We need a revolution today. In April 2020, we need to eliminate the insurance companies immediately. No questions asked. Because the costs of this COVID-19 are going to come crashing down onto individuals, and bankruptcies are going to go through the roof. If people start getting bills for $50,000, $100,000 for having been on a ventilator for a month and a half, what are you going to do with that? How are they going to pay for it? They're not employed. They don't have any money. So who's going to pay for that? And this is all to support a bunch of insurance people who want to make excessive profits. No, it's no good. It's no good. We need a revolution, and we need it today. Thanks for listening.